Hello, and welcome to the Achieve Optimum Health Summit, where we explore how to prevent and reverse chronic illness. I'm Angelina Kardash, your summit host. And today, my guest is Dr. Tiffany Caplan, certified functional medicine practitioner and board certified in integrative medicine. Dr. Kaplan's passion for supporting people using functional medicine stems from her own health journey. She has also seen multiple family members diagnosed with autoimmunity after years of suffering. And since then, she has been passionate about helping those with autoimmune conditions to regain their health and put their disease into remission. Dr. Caplan is the author of the international best-selling book, The Lupus Solution, and co-founder of Caplan Health Institute. It's a virtual health center providing educational resources, courses, and one-on-one coaching for people with autoimmunity who have the goal of achieving long-term remission. Well, welcome, Dr. Caplan. I am so excited to host you here today.
Thank you for having me. I'm happy to be here and part of this summit. I'm glad you're getting the word out.
You are welcome. I know that you take a great pride and pleasure in educating audience on wellness and healthy lifestyle. And that's why I'm so excited to get your perspective on underlying triggers to autoimmunity, especially knowing that you have cured yourself with lifestyle medicine. So tell us about your background and how you got into this field of functional medicine and what is the mission of your practice?
Yeah, so I got into functional medicine because of my own health issues. Like you said, I was struggling with severe depression and anxiety, and just went the medical route, was just given prescriptions, pills, didn't do anything for me, didn't help fix. And I knew there had to be something else. There had to be like a reason why these symptoms were happening. And so I found a functional medicine doctor, and she helped me just understand how my diet and my lifestyle choices and how underlying factors like my gut microbiome and all these other things play into how my symptoms were being expressed or how I was feeling. And so I was able to get off the medications and get my brain fog to go away and all those things that really like gotten my health back. It saved my life, just making those changes. And so that's what got me interested in it. And then I did have family members. I have family members with autoimmune disease. I had somebody get diagnosed with lupus, which is a systemic autoimmune disease. And that's when I realized that there's really not a lot of information, especially more towards a natural approach for people that have autoimmunity, and especially these systemic autoimmune diseases. And there's lack of hope too, that there's anything that you can actually do for them. So having gone through the experience of fixing my health and helping my family, I just saw that we needed to get more information out, and that's kind of what drove us to helping more of the autoimmune patients. And now we help people all over the world reverse their autoimmune disease naturally, and just chronic health issues, you know, on a broad spectrum.
That's a truly amazing personal story. There are not many options for people with autoimmunity, right? And so what sparked your passion for helping this population?
Yeah, so after I had that experience finding out that there really wasn't a lot of information other than like medications for people, and seeing that that wasn't actually helping people, either being on immunosuppressants or these heavy duty medications wasn't fixing the problem. I knew there had to be something else that we could do. And so looking into, you know, in our functional medicine approach, we look at the person as a whole. So looking into diet and lifestyle and different causes and triggers that are making the immune system act the way it is. That's how we can get to fixing the problem instead of covering it up with the medications. So most of our patients, you know, just we make some changes in their daily lives and their nutrition and things like that, and they're able to either get off or decrease their dependency on medications and get their health and their life back. So it's really cool that we can just a lot of times make some simple changes and find out where the problem is coming from, and then we don't have to, you know, be chasing it with prescriptions, which is cool.
So what are the most common medical diagnoses in your medical practice?
So we see we have two practices. We actually have one in California where we see patients just come in for a whole host of different things. So whether it's a hormone balance or thyroid problems or gut issues, but overall we help people like with lupus worldwide. We help people with autoimmune conditions where they're not finding help in their standard doctor's office. A lot of times people don't have access to more of these alternative routes locally. So they're going online and they're looking for people. And so they find, somebody like us that we work, from your living room, we can do a consult, which is cool, and be able to help them focus their health or whatever their health goals are. But we see mostly like autoimmune conditions. So lupus or irritable bowel syndrome or even Hashimoto's, eczema, just kind of across the board.
And what, to your opinion, are the causes of autoimmunity, and how can food play a role in it?
Yeah, and that's kind of the fascinating thing. And that's what I think one of the things that made me so interested in autoimmunity is that there is no one cause. Like we could look at 11 patients that have lupus and they all have different triggers and different reasons why that's happening in their body. And it could present differently in every person too. So it's so fascinating how it's so different. But at the root, it's the immune system being overactive. And there always has to be a reason for that. So the main drivers that we see in autoimmune patients are things like leaky gut, right? Which we know can cause other problems too. But when we lose that protective barrier in our gut lining, our immune system gets so overexposed to the things that we're eating or that are in our environment and becomes overactive. And we get what's called loss of immune tolerance. Our immune system doesn't tolerate things, so it thinks it's bad. And then we can have our immune system think that parts of our own body is bad because of a reaction that's happening there. So food sensitivities are a big role in a lot of times autoimmune conditions. People are reacting to the foods that they're eating and it's making them worse. It's making their symptoms worse. But then there's also causes like just stress, right? Most people have some degree of stress on a regular basis. And so we see cortisol problems and adrenal gland issues, really common with autoimmune patients. People don't realize that stress is not just mental, emotional. It comes from other aspects like having leaky gut or having microbiome problems. We know that 80% of your immune system lives in your gut. And so when there's a inflammatory condition or an imbalance going on in your gut, it's going to directly impact your immune system. Nutrient deficiencies are huge across the board. Doesn't really matter where people live. We've seen things like vitamin D deficiency be really high, like almost epidemic. Everybody's low in vitamin D. That helps regulate your immune system. So that's why it's so important to have something like that in your body. Hormone imbalances, blood sugar issues. So we know that things like insulin and we know estrogen are super inflammatory when there's an excess of them. So sometimes it's working on detox pathways or hormones more specifically. So those are, we see a broad spectrum of different underlying causes. But typically when we look at somebody with an autoimmune disease, they have multiple areas that need to be addressed. And through diet, lifestyle changes can do that to be able to fix those problems.
So essentially it's our lifestyle choices that lead into the autoimmunity. And when I hear from people that, oh, I have, genetics, bad genetics. So it's not really true, right? So basically by our lifestyle choices, we get what we get and we get sick. And you said, leaky gut and all other triggers. I'd like to talk to you about several major chronic conditions and your perspective on how to prevent and reverse this. So let's talk about the GERD, right? And reflux disease. So what is the cause of this chronic condition and what we can do to prevent and treat it effectively?
So one of the most common, a lot of people assume that it's too much acid, that their stomach's making too much acid, and that's what's causing that like burning and that reflux. Actually, way more commonly, we find that people are not making enough stomach acid, and that's actually the root of the problem. So that can happen for a number of different reasons. One, it could be stress, right? If your body is in stress mode and it thinks, you're stuck in fight or flight mode, you're not in rest and digest mode, you're not in the state where your body can effectively make those enzymes because your body wants to run away from the tiger instead of sit there and digest. So you may have stress that's causing it. You may have things like even low thyroid can kind of tie in. If your cells are not getting what they need to function, they're not going to do their job. So even the cells in the stomach that make the acid, if they're not functioning well because of a deficiency, that will create the problem of not making enough acid. There could be infections too. There's certain bacteria that will live like in the stomach or in the small intestine, and that can create problems with digestion as well. Even motility problems. If their gut doesn't effectively move things through fast enough, things sit in the stomach longer and they ferment, and that causes a reflux. And that's a lot of times, related to they're not having enough stomach acid as well. So that's the most common thing that we see with why somebody gets acid reflux or GERD. And sometimes it's even almost silent and people don't get the burning, but they get like a constant postnasal drip or a cough or something like that. And it's still related to like low stomach acid a lot of times.
And what are the way to prevent that? And like, let's say that the person, been diagnosed with GERD. So, and I know that a lot of practitioners, conventional doctors, they just prescribe basically anti-acid medications, which in the long run, even in the short run, can cause like additional problems. So
Yeah.
are there any supplements, anything that you can suggest in that case?
Yeah, you can supplement with betaine HCl. It is basically like stomach acid in a pill. And the way that you can tell if you need it is if you take that supplement with your meal and you don't feel anything, like you don't feel any acid reflux or anything like that. And then the next time you eat, you take more of it. So instead of like one capsule, you take 2 capsules, or the next time take 3 capsules. And the more that you need to take usually means the more deficient you are in the HCl versus somebody that doesn't actually need that or does produce too much acid. If they take that supplement, they're going to get massive heartburn and problems right away. So that's like an easy at home kind of test. There's also the baking soda test you can read online too. You can drink some baking soda water and like see how long it takes if you burp or not. And so there's different like at home tests that you could do. You could drink apple cider vinegar and see if that helps any of your symptoms. Prevention, I think one thing is that people tend to eat too fast and they eat on the go, which is not in a relaxed state. And so then again, you're not in the state where your body is secreting enzymes very effectively. So even taking the time before your meal to do a quick like stress meditation exercise or a breathing exercise to get your body into a more relaxed state before you eat can be helpful. The other thing is carbonated beverages with your meals is not helpful. So I would avoid sodas or even carbonated water. Sparkling water with your meals is not great, or even very high pH water, like alkaline water with your meals, because you don't want to mess with the stomach acid, right? That should be acidic in your stomach. So that will decrease your stomach acid and make you have more problems digesting too.
That's a very good tip, because I know that in opposites, some people, they take this high pH water, right, to treat a lot of diseases. And yeah, that's a good point. And what would you recommend to support optimal stomach acid for good digestion?
So again, just taking your time to make sure you're eating slowly, you're chewing your food fully. Like sometimes we don't even realize that we're not digesting because we're not chewing. Trying not to eat on the go, maybe looking at your water intake around your meal so you're not decreasing your stomach acid. Sometimes people need to also take longer breaks between their meals so they're not kind of grazing all day, to give their gut a chance to process things, move it along, be able to start the process again in a few hours, like not overeating, I guess I would say. And then if you need to, if you're actually deficient in stomach acid, taking that, because if you find your appropriate dose of the HCl and you take it for a while, you should be able to then slowly not need as much and start to wean off of it. And then you won't need to be supplementing anymore.
Okay. Do you have any recommendations for patients with inflammatory bowel disease, especially ulcerative colitis on top of, probiotics, prebiotics, and plant-based diet?
Yes. So overall, when your bowels are inflamed, you're going to have more food reactions. So it's not just plant-based, but you also want to look at, are you eating grains? Because those could be really inflammatory or hard to break down. And for everybody across the board, it's different too with food reactions. It's not just one size fits all. So yeah, you can get rid of the sugar and the dairy and the things that we know are inflammatory, but what about nightshades, or what about high lectins, or things that are hard to digest? Those are creating more stress and inflammation in the gut as well. And then also for things like ulcerative colitis or Crohn's, or any of these irritable bowel syndromes or leaky gut syndromes, right? We have to help fix the gut lining. So things like L-glutamine, that's a supplement that you can take, helps with literally repairing that gut lining and creating a healthy barrier system. Things like marshmallow root or licorice, those also help the gut lining. So there's a lot of different formulas out there that combine all of those great different herbs into like a drink, a powder that you make a little shake out of. And those are good. We find a lot of times using immunoglobulin therapy, so liquid immunoglobulins or powder form, again, make a little shake out of it. That helps with calming down the immune reactions in the gut. Because we know, again, that most of your immune system lives in the gut lining. And when that's overactive, that's part of that process that's creating the irritable bowel syndrome. Those are all autoimmune as well. So treating it like an autoimmune disease, figuring out the root causes, helping support the gut barrier, looking at the microbiome. A lot of times people have overgrowths of different species, whether it's bacteria, yeast, parasites, or just a lack of good diversity in their gut. Because if they're on, if they're doing like a really strict diet for a long time, if they're doing like an AIP diet for a long time, that's going to cut back on the microbiome diversity, and that's not going to help the gut be very healthy either. So on one side of the spectrum, like, you want to be able to cut things out of your diet that are causing inflammation, but you also don't want to be on something so restricted that then you're creating more problems. So it's like finding that balance, and then supplying the gut with what it needs to be able to heal itself. So again, even like vitamin D, vitamin A, zinc, those types of ingredients, which a lot of times you can find in formulas that kind of go all in one.
You've mentioned elimination diet, and for some people, it's really hard to, basically go through elimination diet by themselves. I've tried to do it many times, and without the help, I cannot figure out what triggers me. So how the functional medicine help with all of that? So when you see the patient for the first time, what's your approach to give him a specific treatment plan?
Yeah, and so going with the elimination diet, because that's a really good starting place for most people to consider. I find that it's important to understand why you do it so that it makes a little bit more sense and you have a little bit more motivation to stick to it, because it is not a lifelong thing, right? Like, you just have to eliminate it for so long, and it's 21 days is the minimum. And the reason is because your immune system, when it has a food sensitivity reaction, the half-life of that reaction, or how long it stays active, is 21 days on average. So you have to cut something out for at least 21 days to see a difference without it, to really have the impact of not having that in your system. And if you cheat here or there, and even if you have it like once a week, like, that's still enough to create that inflammation, and you won't really even feel the difference of it being out of your diet. So to understand that, yes, it's restrictive and it's hard, and you really have to be committed to doing it. That's one thing to understand. But the other thing is, it's only 21 days that you have to do it. And then after that point, if something's been kept out for at least 21 days, you can start the reintroduction process, which is even more important, and knowing how to do that appropriately. So we help patients kind of walk through the process of okay, now you're ready to reintroduce foods. How do we do that? And typically it's, you add a food back in, one food at a time. You wait 3 or 4 days. If nothing's changed, if no symptoms came back, everything's still good, then you can keep that food in and you add the next food. And it's just a process of like adding and adding and adding. And if you find something that's reactive, keeping that out for a little bit longer. So that might be out for another like few months or long term, but at least you can narrow down that list of the things you actually need to avoid versus just avoiding everything because you don't know, right? So that's a good starting place, I think, for people is just understanding, okay, why you got to do it for 21 days, because it's only 21 days. It goes pretty fast. The first week is the hardest. And usually it's just because there's a learning curve of like what to do and what to eat. But we also help our patients with like recipes and handouts, and they work with our nutritionists to help with any questions they have. So it's a little more hand holding when you're doing it by yourself. It's a little harder. I know, I've been there.
Are there any alternative approaches like food sensitivity testing?
I don't find that the blood testing is as accurate as we want it to be. There's still always a lot of questions that come up. So let's say somebody has bad leaky gut, and we do a test to see what they're reacting to. They could show up with everything positive on the test or nothing positive on the test. And then we're back at square one because we can't eliminate everything, and we can't, if nothing shows up. And there's different reasons for that. So it depends on how active the immune response is in that person. If their immune system's getting exposed to everything they're eating, it's going to look like everything they're eating is a problem when maybe it's not. So that's where it gets a little tricky to use those tests. Sometimes after an elimination diet, if we're still having a hard time kind of pinpointing, we will do further testing. But for the most part, we work on healing the gut and reintroducing the foods, and people can usually tolerate most of the things that maybe were a problem before.
Okay. What are the best strategies for thyroid issues? And we know that, more women are affected than the men. And can dietary approach alone work if a person have thyroid issues, or it's necessary to supplement with thyroid hormones? And what's your opinion are best, synthetic versus natural?
Yes. So with thyroid, the majority of the cases that we see, the people have been diagnosed with a thyroid issue and are put on like thyroid medication. About 90% of the time, it's actually due to something called Hashimoto's, which is autoimmune. And so it means that it's not necessarily the thyroid gland that's actually creating the problem. It's your immune system that's literally destroying the gland that's creating the problem. So going after it like an autoimmune disease, figuring out the triggers, figuring out the underlying reasons of why that's happening, that's how we would address most of those cases. If it is simply a low thyroid and they're just not producing the hormone like they should be, there's a lot of different reasons for that as well. There's about 20 different things that can go wrong that lead to the symptoms of having low thyroid levels in the body. So the first thing to understand too is that your gland, what it mainly produces is the inactive form of the thyroid hormone called T4. And your body doesn't readily use that hormone until it gets turned into another form called T3, which is the active form of the thyroid hormone. And that doesn't necessarily happen in your thyroid gland. That happens a lot of times outside the body or outside the thyroid, in places like the liver and the gut. So those other places of the body have to be working optimally and healthy to be able to convert the hormone into something your body can actually use. That's where I find a lot of the problems lie, is that there's other things like inflammation and stress and gut issues or liver issues that are blocking that ability. And so people are, maybe their gland is working fine and producing the hormone, but it's not converting to something that they feel. Now going over like the different types of hormones, it's not always natural is better. It really depends on what the person is missing. So some people actually do need to be on a hormone replacement. If they, don't have a thyroid gland, if they had to have their thyroid taken out because of cancer or nodules or something, then they need to be on a thyroid hormone. if somebody has had bad Hashimoto's for a long time and their immune system has literally destroyed their gland, they probably need to be on hormone too. So the hormone replacement literally just gives your body what it should naturally be making. And for the majority of people that we see, once they fix the reason why they're not having enough thyroid hormone, whether it's a conversion problem or an inflammatory problem or whatever, like they don't need to be on as much hormone or even be on hormone in some cases. But when it comes to the different types, the most common are the synthetics, so Synthroid or levothyroxine and things like that. And those are just direct replacements of the thyroid gland. So they don't fix any problem. They're just kind of like a Band-Aid, right? They're just giving you what's missing. Versus there's the bioidentical hormones like Armour and Thyroid, and those have a combination of both the inactive hormone and the active hormone, so T4 and T3. And so some people will feel a lot better on those hormones because they're getting the active form of the hormone, which tells me then that their body's not converting it very well, right? So it can kind of be diagnostic in itself how they feel. So it's not always that one is better than the other. It's just kind of what the person's body needs. And you can be really specific in using those things, but our goal is always to figure out why the problem's there in the first place so that they don't have to rely on, medication for the rest of their life, if possible.
So you've had patients in your practice that basically went to remission and they stopped using the medications, right? And hormone therapies.
Yeah, they got to the point where their labs were so stable, their symptoms were so stable that their doctor just kept taking them off of the hormones, and then they haven't needed them. They're just their gland is working well, they're converting it well, they're feeling good, their Hashimoto's is in remission, whatever it is, and they don't need to take the hormones anymore.
What our listeners can do themselves to take control of their condition?
In general, I think people need to just listen to their bodies more. I think we kind of tune out a lot of the symptoms that we experience on a regular basis. So whether it's fatigue, insomnia, pain, what are the things that we're experiencing? Because a lot of people just kind of assume the things they feel on a regular basis are normal when they're just so common, but they're not. Symptoms are the body's way of telling you that something is wrong. So figuring out what is your body trying to tell you? What types of symptoms are you experiencing? The second thing is looking for more answers. So a lot of times, unfortunately, the standard labs that get run are not enough to find answers. So when your doctor tells you that your labs are normal, but you're having all these symptoms, not accepting that answer and kind of digging a little bit more, because you have that's not okay. So maybe finding somebody that is more in a holistic field, functional medicine field, that's going to help you do more testing or figure out where the root of the problem actually is, and become your own health advocate. Advocate for yourself, ask questions, do research. Knowledge is really powerful, but you also have to use it, right? You can know everything, but if you don't do anything with it, you're not going anywhere. So you have to start making some changes and looking at your health really critically in terms of diet and lifestyle and the things you're doing on a regular basis, because that's where you're going to find your answers and that's where you're going to find your solutions.
Absolutely. Absolutely. I truly believe that our health, and basically we control our health. It's in our hands, and we can do everything with all available resources online and listening to, summits as you do and I do, and learn from speakers, learn from patients how they heal themselves. So that's very important, just, to be educated on your own health.
Yep.
Let's explore a bit about the supplements. What supplements do you recommend to people for optimum health?
Number one thing I find most people need is vitamin D. So vitamin D is really important. Most people are deficient. When we look at a standard lab range, most of the time vitamin D is considered normal if it's anywhere between 30 and 100, which we know that 30 is still really low. For most of our patients, we aim for at least 70 and above. especially if somebody has a really inflammatory condition or autoimmune condition. So vitamin D is really important. A lot of times people are not supplementing with enough too, so the amount that they're taking really matters. Usually 5,000 units is a maintenance dose. I usually have people start with like 10 to 15,000 a day, which seems like a lot, but just to get the levels actually absorbed. And we usually use it in a liquid form, so that, you know, it matters to what form they're getting. The other thing, because I work with a lot of autoimmune patients, glutathione is super important. Glutathione is a antioxidant that the body naturally makes, but when your body's under a lot of stress or dealing with a lot of inflammation, like, you use up that glutathione faster than you can make it. And that's another thing that helps regulate your immune system and helps with detox systems and just pretty much every cell in the body. So that's really important. The other things would be, you know, multivitamins. Some people are like, why do you need a multi if you're eating healthy? We need it, you know, to fill in the gaps. Our diets can't actually give us everything, unfortunately, because our food is not as healthy as it used to be. Our soils are depleted of nutrients. We're not eating enough of the variety that we should be. So I think finding a good like multivitamin is helpful for people. Omega-3s are really good as well. So those are some of the staples that I find just kind of help fill in the gaps to our diets and if you're having like a healthy diet and lifestyle.
Right. And is remission for autoimmunity is, possible? And tell me, the patients with lupus, do they have any hope?
Do they have
Any
hope?
Yeah.
A lot of times, unfortunately, we see patients coming in without hope. Like this is their last hope. Like they've tried everything. They've listened to their doctors. A lot of times it even takes on average about 7 years of struggling with symptoms to even get a diagnosis. And then they're just put on medications and kind of told like, that's it. That's all you can do. So a lot of people don't have hope, but that's our job that's my passion really, is to like be able to give hope to people that don't have it, inspire that you can change. Like you don't have to be stuck feeling the way that you are. Remission with lupus, remission with autoimmune disease is possible. We see it every day. It's just one of those things that there is no miracle cure. So it's complicated, right? There is no magic pill. There's no magic diet. It's different person to person. So that's where we have to be really critical in looking at personalizing the approach that we take with each individual. But when we do that, we see pretty amazing results, like people getting off drugs that they were told they're going to be on for the rest of their life and getting function back that they didn't have and being able to just live a healthy, optimal life again. So yeah, remission is possible. And one of the things I want to get out the message is like, don't give up hope, because the second you do that, you lose the chance of actually getting better. If you just think, you're going to get better, even that mental, emotional component of like visualizing getting better is actually very helpful. And scientifically, we've seen that helps too. So don't lose hope and know that you don't have to settle for feeling less than optimal.
Yeah, emotional health is a huge driver for people to get well. Yes, absolutely. Yeah. Can you tell us about your book, The Lupus Solution?
Yes, so we wrote this book. It is more specific to lupus being more of a systemic autoimmune disease, but we do touch on just information for general autoimmunity too. So looking at what are the major drivers of why somebody develops an autoimmune disease. We just wanted to really help people understand the why behind autoimmunity, how it happens, how they can make changes in their daily life to not only get into a remission state, but avoid the flare-ups that happen and the complications that happen with autoimmunity. So it's just a very broad understanding of this is what's happening in your body. This is how you can take control of it. And we wanted to write it for patients, right? We didn't want to, most of the information out there about things like lupus is written for doctors and it's all just medication jargon. We wanted to make it something that's understandable for the public to know what's going on in their body. And that was our goal with that.
And finally, tell us about your Caplan Health Institute initiative.
Yes. So in our Kaplan Health Institute, like our goal is to, again, educate people on the possibility of getting into remission and gaining health in their lives again. So we work with patients across the globe, depending on what they're looking for help with, helping them get to their health goals through a natural approach. So we work a lot through just diet, lifestyle things, teaching people how to fix their bodies on their own, right? Like what are the things you need to be looking at on your daily basis, how to implement those things. We kind of help walk people through if they need to do like an elimination diet, or they need to learn how to do stress management or exercise and stuff like that, kind of walk them through the process and the steps to educate them, because our goal at the end of the day is always to just help people get to the place where they don't need us anymore, because everybody is capable of that. Everybody's capable of being able to take control of their health and not have to rely on somebody, a doctor or something to help them. We have the ability to control our health by the choices we make on a daily basis. So that's always our goal, is to just get the person to understand their body more than they ever have and know how to take care of it. It's like giving you an owner's manual for your body.
This is such an empowerment, to hear that from the healthcare professional, that really people can take control of their lives.
Yeah.
Dr. Kaplan, where our viewers can find you, and tell us about your free gift for our viewers.
Yes, so you can find us at caplanhealthinstitute.com, as Kaplan with a C, or on social media, same thing, Kaplan Health Institute. So we share lots of free resources. The gift that we shared with you guys, we actually have a couple gifts too, and you can find more on our website, but one is like a self-care guide to help with like autoimmunity. The other is recipe book. So that also, give you some ideas of how to eat healthier on a day-to-day basis. So we have resources like that, and you can get those on our website, and then also with the summit.
That's great. Well, thank you so much, Dr. Tiffany, for being with us today. And I deeply appreciate all the work that you do in the world. And thank you for taking a stance and educating people on how to prevent chronic conditions. And I think you make such a positive and profound difference in the world.
Well, thank you for having me. I'm so happy to be part of it.
Absolutely. And I'd like to encourage our viewers to take a time and check Dr. Kaplan's website and for more information and insight on how to prevent chronic conditions. Stay healthy always. I am your host, Angelina Kardash, and thank you for watching us.